Hi there, my name is Dr. Randall Fuerst, and I'm an optometrist practicing here in the Sacramento area, and my passion is for dry eye. There's two major reasons for that. One is that I helped open 10 laser centers throughout California, and one of the early things that we suddenly went, oh no, about was that we had patients coming in and saying, oh, I'm so excited about laser because I could never wear contacts. And then you find, okay, great, let's do LASIK, and then you find out that the reason that they couldn't wear contacts was because of dry eye. And now we do LASIK, and we create an environment of dry eye for those patients, and instead of having happy, thrilled patients, we have very unhappy and disappointed patients. And so we really had to throw ourselves into learning the ins and outs of dry eye and how to measure, and the various factors that contribute to dry eye. Second one was my wife. My wife battles dry eye, and so here I am, this expert taking all kinds of courses and have a lot of high-tech equipment and so on, and yet my wife continued to suffer with dry eye. And so fortunately we've been able to help her, and so this has been somewhat of a journey for me, to very personal journey that directly affects my profession and my professional life. So it's something that I'm passionate about. Studies indicate that there's somewhere between 30 and 40 million Americans, so 10% of the population, 10-11% of the population experience some degree of dry eye. Now it runs a spectrum, and so there's some people with severe dry eye that just have a hard time getting up in the morning and opening their eyes without fear of tearing the cornea, having to pull off the road when their eyes start burning and are watering and irritated and dry so much that they can't see well enough to drive, to other people that pull out some tears and some artificial tears and use those periodically. In our patient base here at the office, the reality is that we tend to have more people a higher percentage, because they will self-select and come into the office. So we're probably running in the 35 to 40% range of patients that do in fact have dry eye. Dry eye is a multifactorial thing. One of the issues is aqueous production or tear production, and it does drop a little bit. There are some diseases that cause it. Surprisingly, that's not the most common, but that is one of the main reasons why the pharma companies are seeing and projecting a multi-billion-dollar increase in sales over the next 10 years of artificial tears. So that's a big factor. The second factor is the evaporative eye disease, and you have 40 glands on your lower eyelid and 40 on your upper, called meibomian glands, that secrete a real fine oil, a lipid layer that coats the tears, that slows the rate of evaporation. Those can get clogged up. That is by far the leading contributing factor to dry eye disease. Now you throw in the third leg of the chair, if you would, or the third contributing factor to dry eye is inflammation, and things like allergies. All of a sudden the dry eyes are worse, or you're wearing contact lenses and you're not producing enough tears, so the lens just ever so slightly glides against the eye. That does that 10 or 15,000 times, and all of a sudden the eye is becoming inflamed, and that can really exaggerate or exacerbate the dry eye type symptoms. So inflammation, tear production, and evaporation, all three of those are major factors that in combination contribute to dry eye. MGD is meibomian gland dysfunction. It is fast, at least in the eye care world, becoming the major factor and contributing factor to dry eye disease. Again, dry eye disease is multifactorial, and it usually isn't going to be just purely MGD or aqueous deficiency or inflammatory reaction, but it's going to be a combination of those. MGD, though, study after study is indicating it is the number one factor that contributes to dry eye. Meibomian gland dysfunction is, again, there's a number of things that can cause it. We know that one of the regulating hormones that help to oversee the production of meibum, and the rate of production is testosterone. And so as men and women, men have more than women, but as we age and the testosterone levels go down, that's why perimenopausal women have more problem with dry eye. Is one of, I mean, that is one of the, probably, if not the major cause, is that now they're not producing as much. So sometimes there's a hormonal factor, there's an environmental factor. If you're in a dry climate, that's going to be more of an issue. If you have allergies, now that's going to cause an increase in inflammation and such to the eyelids, to the eye, to the conjunctiva. All of those can start to choke off those 80 glands of the meibomian glands. And then in addition to that, then we are really having to look at blink rates, and the fact that blink rates are diminishing in this world of mobile devices and so on. I'm not sure why, but study after study, and we see it in the office. We have technology now that high-speed video that counts your number of blinks and how many were complete and how many were imperfect blinks or impartial blinks or partial blinks, and that is amazing to see the drop in the terms of the blink rate. And so that's crucial. Another thing is makeup and mascara. If you paint mascara or makeup right along the rim of the eyelid, right over those little orifices, they're gonna have a little harder time getting past that. And so if they're not robust, that's an issue. If we don't clean the eyelid surfaces efficiently enough, then that can be a problem. You have 40 glands on the lower eyelid and 40 on the upper eyelid of each eye. So those 80 glands secrete the oil layer that coats the tears, that helps the tears become a good optical surface. And also, they are critically important to cutting down on the rate of evaporation and keeping the tears healthy and robust so that they don't evaporate for between 8 and 12 seconds. When that happens, then the meibomian glands can start to swell up. And then if that back pressure doesn't cause the blockage to dislodge, then it can start to begin to get distended. And then if that doesn't happen, then it starts to shrivel up and shrink and shrink and shrink, and what we call truncation. And if left to its demise, then they'll actually die and go away. And once they're gone, they're gone. As those glands aren't producing enough oil, the evaporation rate causes dryness, and so you get across the corneal surface, you get a big dry spot here and over here and up here, and that tissue becomes irritated and inflamed, and the symptoms and the irritation level begins to rise. From there, then if you keep exposing the surface of the eye, then it's like chafing, or we'll get like a Brillo pad, like somebody's scraping across, and we will see, and we will use dye on the corneal surface, and we will see significant chafing on the corneal surface, and so that is a disease state. Then the eye tries to heal itself. It gets worse. Then it's like a sunburn when the skin, now the body wants to get rid of that old damaged skin to get the new skin. So then it's absolutely an inflammatory nightmare, and the patients are uncomfortable, and so the symptoms just keep getting worse and worse and worse. And that's why we want to try, like anything else, you want to try to discover it early, treat it early, so it never progresses into becoming an enormous problem. Very simply, Lipiflow is called thermal pulsation, and thermal meaning heat. And so what it does, it's the best form of treatment to be able to get to the glands on the inside of the eyelid and to heat them up sufficiently and for a long enough time period to begin to melt the waxy buildup so that you can begin to dispel the blockage. You have to get rid of the blockage. And so the heat is one, and then it begins to pulse and begins to help to express those glands and get them cleaned out. And it's the best way and the only FDA approved way in order to do so. The Lipiflow treatment of thermal pulsation takes right at about 12 minutes. in terms of how long the results last with the Lipiflow thermal pulsation, it depends on the severity and when you catch the disease. If the glands you have a full set of glands and there's a mild to moderate degree of blockage, but the glands are still there, coupled with good ophthalmic or ocular hygiene with heat and just keeping the lids clean and so on, can last 2, 3, 4 years. The Lipiflow process has these little things called actuators, and the eye goes right here, and then the back surface of this heats up. The upper eyelid goes in the upper sleeve, and then the lower eyelid goes in the lower sleeve, and then the bladders fill up and it heats up to 10 degrees above skin temperature, and then it does that for 12 minutes, and that has been shown to be perfect for being able to melt the waxy buildup that takes place. And then the actuator here begins to pulse, and so it will increase pressure and then let off pressure, then increase pressure, and then it actually goes up, down, up, down, up, down, so that it's expressing those glands and getting the blockage and the oil and so on that has gone rancid in the glands, and gets rid of that. And so that's how these work. We do use an anesthetic drop to numb the eye, but most patients report that this is a soothing spa-like experience. When you take it out, their eyes are the most moist they've had in years, and so really it doesn't hurt at all. Recently, Johnson & Johnson, a major pharmaceutical company, acquired Tear Science because of the wonderful technology, and it adds, like it does in our practice, it completes the package of dry eye treatment that we have. So anyhow, we're very excited about Lipiflow and adding it to the practice.